Coronavirus, also known as COVID-19, is a novel virus that was first identified in the fall of 2019. By February of 2020, the World Health Organization had termed it a worldwide pandemic.
A pandemic is when a new disease first emerges. Most of us lack natural immunity to fight it off. This can cause a sudden, sometimes rapid spread of disease between people, across communities, and around the world. Without a natural immunity to fight off an illness, many people can become sick as the disease spreads.
Symptoms of COVID-19 include mild to severe respiratory illness with fever, cough, and difficulty breathing.
While anyone is at risk to get infected, some are at higher risk for serious illness from COVID-19.
Those at higher risk include people aged 65 and older and people of any age with serious underlying medical conditions.
COVID-19 spreads mainly from person to person through respiratory droplets that are produced when an infected person coughs or sneezes and droplets land in the mouth or nose of those nearby.
There's currently no vaccine for COVID-19 and treatment options are limited. So the best way to prevent getting the illness is to avoid being exposed to the virus.
The Centers for Disease Control, otherwise known as the CDC, now recommends covering your mouth and nose with a cloth face cover when around others, such as going to the grocery store or if you work around others.
We now know that a significant portion of people with the coronavirus may actually be asymptomatic. This means they show no signs of the illness but can still infect other people with the virus.
Wearing a cloth face mask is meant to protect others in case you are infected. It does not ensure that you will not be infected while wearing one in public, and it is not a substitute from distancing from others.
Wearing a face mask meant for a healthcare worker is not recommended. A surgical mask or an N95 respirator are critical supplies that must continue to be reserved for our healthcare workers and other medical first responders.
Cloth face coverings like this bandana that I made should fit snugly against the side of your face and be secured by loops or by ties against your head.
Cloth face covering should include multiple layers of fabric, but should still allow for breathing without restriction.
Routine washing of mask or face covering is recommended depending on the frequency of the use. If worn daily, then washing daily would be appropriate. Homemade masks or face coverings should be washed in a washing machine.
Continue to keep 6 feet between yourself and others. The cloth face mask is not a substitute for social distancing.
When removing a face covering, individuals should be careful not to touch their eyes, nose, or mouth. Do not touch the outside of the mask, rather remove using the ties or ear loops. Then wash hands immediately after removing.
Children younger than the age of 2, anyone who is having trouble breathing, anyone who is incapacitated or otherwise unconscious, those that are unable to remove a mask by themselves without assistance should not wear cloth face coverings.
If you think you may have been exposed to COVID-19, contact your healthcare provider immediately or contact the St. Louis County Health Line at 314-615-2660.
The CDC now recommends wearing a cloth face mask before going out to do grocery shopping or things during the day. So this is a quick way you can make a face mask using a t-shirt if you don't have the option of sewing one. So I've pre-cut mine just for, quickness of the video, but this is a regular t-shirt. First I measured from ear to ear with a tape measure and then nose to chin just to try and get a guide on how big of a square to make. So then I marked dots on my shirt using a ruler, and then I made my cuts. So first I cut just the bottom off and then the top off. So now we have basically this. So then I cut out the straps and then I cut the back off. So now we're just left with this basically. So then these will be attached. So then you'll cut these apart and now you have your straps and you can put it on. The CDC does recommend, if you want a little more protection, you could use a coffee filter with your face mask to put on the inside. And just kind of adjust it, and you're ready to go. Thanks for watching.
Here we have the supplies that we start out with, kind of make it an assembly line like activity. First we have the fabric and the patterns, and we cut out a bunch of the patterns from the fabric. Here's the lining and the front of the mask, and also the bias strips that we use to tie them on. Then we sew the fronts together for the front and the lining. Pin them all up with the ties inside, and then out comes the final mask. And we put it in a Ziploc bag to ship off to its new home.
Hi, I'm here to let you know how to safely put on a cloth face mask. And I have a face mask made for me by one of the other school nurses. And first I wanted to let you know that you always want to wash your hands or use hand sanitizer before you put on your mask. And so I've done that already. And so usually what I want to do is put the mask over my nose first with the upper straps. And so I just position it over my nose, high on my nose, and I tie up high on my head. And then I take the lower straps and tie securely behind my neck. I want to make sure that there's a nice fit along the sides, under my chin, and the bridge of my nose.
Several types of face mask. I am currently wearing a reusable cloth face mask. I want to make sure before I remove my face mask that my hands are clean, either with soap and water or hand sanitizer. Next, I want to take my clean hands, and I don't want to touch my face. I want to stay away from my eyes, my nose, and any part of the front of my mask. I want to undo the tie of my mask at the top, and then I want to undo the ties to the back of the neck. I want to take my mask and I want to place it in either a plastic bag, Ziploc bag, a paper bag, or a container that's labeled with my name on it so no one else shares the same bag. It's a good idea to wash your cloth mask with soap and water in the washing machine or the sink frequently. Then I want to practice good hand hygiene. I want to wash my hands for a good 20 seconds, get a good amount of soap on, get a good lather, wash the inside of my hands, outside, the nails, sing the happy birthday song twice or count to 20. Once I've done that for 20 seconds, I want to turn off the faucet with my wrist and I want to thoroughly dry my hands. It's a good idea to change out your hand towel frequently as well. If soap and water is not available, go for the hand sanitizer. Put on a good amount, rub your hands, get them all wet, and keep rubbing until they're dry. And that is how we properly remove our face mask.
Parkway school nurses care about you and your family. Please reach out to your school nurse if you have any questions or concerns. Thank you.